we had finished the local autoimmune diseases. Okay, we are done with that, and I hope you all have understood. And now today we'll start the systemic autoimmune disease. Just like local autoimmune diseases, you will also find several types of systemic autoimmune diseases. The one we will be studying today is systemic lupus erythematosus. Now, you probably might not have heard about this disease before. The systemic lupus erythematosus, this might be a new kind of disease. So let's see what is it. Systemic lupus erythematosus, what is it? It is an autoimmune disease, and in this disease, what do we see? That the immune system of the body, it against, just like the other diseases that we have seen, just like the other autoimmune diseases that we have seen, here too, the body's immune system, what it does, it mistakenly attacks the healthy tissues of the body. But now here, when this kind of problem arises, it is not confined to one particular organ. Previously, in local autoimmune diseases, what we saw, it was just one organ which was affected, one target organ. Like if it occurred in the, if the immune system build up autoimmune, what do you say, autoantibodies against the thyroid hormones, then it is only the thyroid area which is affected, not the entire body. Yes, the mechanism would be affected of the entire body, but in the beginning, it's only the thyroid hormone, or the or like the pancreas in cases of type 1 diabetes, that the pancreas is affected. So, but in systemic lupus erythematosus or in systemic autoimmune diseases, what do we see? The entire body is affected for this. You cannot predict in which organ it is going to affect. So similarly, systemic lupus erythematosus, what do we see? The immune system of the body, it mistakenly attacks healthy tissues, and it can affect any part of the body. It can affect the skin, it can affect the joints, kidneys, brain, and other organs. Now, we again do not know the cause of this particular disease. It may be linked to following factors. It may be linked to genetics, environmental conditions, hormone, or certain medicines. This particular disease is seen to be more common in women as compared to men. And the ratio is almost like 10:1. To any age group, it may occur. However, it appears most often in young women between the ages of 15 and 44. It is more commonly seen in like people of Africa, or African Americans, Asian Americans, African Caribbeans, and Hispanic Americans. So what we can say is that in USA, the disease is mostly prevalent. The symptoms that we see in this is that symptoms vary from person to person, and everyone with systemic lupus erythematosus will suffer from joint pain as well as swelling at the same time. Some develop arthritis. Then then this disease often affects the joints of the fingers, hands, wrist, and knees. So these are the other common symptoms that we see. Like you will see chest pain, you will see a person suffering from fatigue, there will be fever, general discomfort or uneasiness, then hair loss, weight loss, mouth sore. Another important symptom which is seen in this disease is a skin rash. Okay, this skin rash is named as butterfly rash. The butterfly rash develops in about half the people with SLE. The rash is mostly seen over the cheeks and bridge of the nose. It can be widespread and it gets worse in sunlight. That means these people are sensitive to sunlight. Then swollen lymph, the lymph nodes will swell. The other symptoms that may be seen in the body are, it will affect the brain and the nervous system. So the person very often suffers from headache or weakness, vision problems, then memory and personality changes, problem in the digestive tract, then problem in the heart, lung, skin, kidney, in the circulation, blood circulation, and other blood abnormalities. So this picture here shows the butterfly rash that I was talking about. See, the rash that we see is mostly on the cheek and the bridges of the nose, and gradually it it extends. So you see, it takes a shape like that of a butterfly, and that is the reason it's known as butterfly rash. So this is the skin symptom that is seen in these patients. Okay, now I will show you a video, and I hope you can uh, listen to the sound of that too. Just wait.
All right, systemic lupus erythematosus. Okay, we totally got this. Systemic is easy and refers to affecting multiple organs in the body. Erythematosus means reddening of the skin. All right. Lupus is Latin for wolf, so affects multiple organs, wolf, reddening of the skin. Not exactly. The modern use of lupus usually refers to a variety of diseases that affect the skin, which was possibly originally used since these diseases resemble a wolf bite on the patient's skin. Is that true? Who knows?
Did you understand this? What did they say? See, they are here defining the whole definition of systemic lupus erythematosus. Okay, so what they are saying is systemic here means when it affects the multiple organs, the disease is spreading to different organs. Erythematosus, that means reddening of the skin since it's affecting the skin. Now, this word lupus is a very old term, and previously this was used to define wolf bite. Means the on the scars on the skin that is seen resembles like that of the wolf bite, and that is why the term lupus was used. And so on, the name remained the same, and it has been
The
named as
skin,
systemic lupus
which was
erythematosus.
possibly originally used since these diseases resemble a wolf bite on the patient's skin. Is that true? Who knows? At any rate, systemic lupus erythematosus, or SLE, sometimes just lupus, is a disease that's systemic and affects a wide variety of organs, but notably often causes red lesions on the skin. Alright, but how does lupus affect all these organs? Well, usually the immune system protects the body's tissues from invaders, but lupus is an autoimmune disease, which means that the immune cells start attacking the tissues they're supposed to protect. With lupus, essentially any tissue or organ can be targeted. And just like a ton of other autoimmune diseases, it's not completely clear why it develops. And like most diseases, it's the result of both genetics and the environment. Alright, so let's go over a specific scenario to show how this usually plays out. Let's say that this guy has susceptibility genes, genes that make him susceptible to getting lupus. And he's exposed to UV radiation in sunlight, which we know is an environmental risk factor for lupus. Well, given enough UV rays, think like sunburn, the cell's DNA can become so badly damaged that the cell undergoes programmed cell death, or apoptosis, and it dies. This produces these tiny apoptotic bodies and exposes the insides of the cell, including parts of the nucleus, like DNA, histones, and other proteins, to the rest of the body. Well, those susceptibility genes specifically have an effect on this person's immune system, such that their immune cells are more likely to think that these are foreign, or antigens. And since they're from the nucleus, we call them nuclear antigens. And those immune cells try to attack them. Not only that, though, susceptibility genes also cause this person to have less effective clearance, essentially meaning that they aren't as good at getting rid of these apoptotic bodies, and so they end up having more nuclear antigens floating around. This means that B cells might swing by, see them, and start the production of antibodies against these pieces of nucleus, which are called anti-nuclear antibodies. And these guys are present in almost all cases of lupus. Alright, so those anti-nuclear antibodies bind to the nuclear antigens, forming antigen-antibody complexes. These complexes can get into the blood and then drift away and deposit or stick to the vessel wall in all sorts of different organs and tissues, like the kidneys, the skin, the joints, and the heart. Deposited complexes then initiate a local inflammatory reaction, which causes damage through the activation of the complement system, which, after a huge cascade of enzyme activation, leaves cell membranes with channels that let fluid and molecules go in and out all willy-nilly, causing the cell to burst and die. Usually, though, you'd want this to happen to a foreign cell or an infected cell, not healthy cells. When tissues become damaged as a result of these immune complexes, it's known as a type 3 hypersensitivity reaction, UV radiation isn't the only way to damage cells, though, right? It therefore isn't the only trigger that's thought to be associated with lupus. Other potential triggers that have been associated with lupus include cigarette smoking, viruses, bacteria, use of certain medications like procainamide, hydralazine, and isoniazid, as well as sex hormones, particularly estrogen, which might be partly why lupus is more common in women, especially considering it's about 10 times more common in women than men during reproductive years, but only about 2 or 3 times more common in childhood or past the age of 65. Okay. As a quick recap, the model that's generally thought to be what leads to the symptoms of lupus starts with some environmental trigger, which damages cells and causes apoptosis and the release of nuclear antigens. At this point, the genetic components come in, and the person likely has certain genes that make them not so good at clearing these apoptotic bodies and nuclear antigens. So you end up with a lot of nuclear antigens floating around. In combination, they probably also have genes that cause their immune cells to recognize these nuclear antigens as foreign, which initiates an immune response, creates anti-nuclear antibodies that bind to the antigens and then float around and deposit in various tissues, which causes inflammation. These deposits and inflammation seem to be the cause of most of the symptoms of lupus, which remember is a type 3 hypersensitivity reaction. Many patients, though, also develop antibodies targeting other cells, like red and white blood cells, and molecules like various phospholipids, which can mark them for phagocytosis and destruction, leading to additional symptoms. And this is considered a type 2 hypersensitivity reaction, although it isn't fully understood why some of these antibodies targeting specific cells and molecules develop. So the classic presentation of lupus is fever, joint pain, and a rash in a woman of childbearing age. But the actual diagnosis is difficult because it can affect a variety of people of different genders and ages, and there are also a wide variety of symptoms. There are general symptoms like fever and weight loss, as well as specific symptoms depending on the specific organ system being affected and damaged. In fact, it's so unpredictable that a diagnosis is given only when 4 or more of 11 diagnostic criteria are met. The first few have to do with the skin and often happen to sun-exposed areas. The first is a malar rash, meaning a rash over the cheeks that spares the nasolabial folds, sometimes just called a butterfly rash, and this appears after sun exposure. Second is a discoid rash, which are chronic rashes in sun-exposed areas that are plaque-like or form a sort of patchy redness and can scar. Finally, a general photosensitivity of the skin, essentially a catch-all category for other rashes that happen to sun-exposed areas, typically only lasting a couple days. Another type of tissue that can be damaged is the mucosa, which is the inner membrane of various tissues. So the fourth criteria is ulcers in the mucous membrane of the mouth or the nose. Along with the mucosa, lupus can also affect the serosa, which is like the outer membrane of an organ or tissue. So if it gets inflamed, people get serositis, which could manifest as something like pleuritis, which is inflammation of the lining around the lungs and the chest cavity, or as pericarditis, inflammation of the lining of the heart. Although this isn't strictly a criteria, it's worth noting that lupus can affect any layer of the heart, meaning in addition to inflammation of the pericardium, they might also have inflammation of the endocardium and myocardium, leading to endocarditis and myocarditis, of which the former presents as Lippmann-Sachs endocarditis, where vegetations form, which are essentially these clumps of fibrin, a blood clotting protein, and immune cells, around the mitral valve. Next, if the joints get inflamed, patients might also develop arthritis, specifically needing 2 or more joints to meet the criteria. If the kidneys are affected, patients might develop renal disorders, like abnormal amounts of urine protein, or diffuse proliferative glomerulonephritis, inflammation of the glomeruli. For reasons that aren't completely understood, some autoantibodies that target receptors in the brain have been implicated as well. And this can cause neurological disorders like seizures and
Answer 1 এইটো সিহঁতৰ এটা হেৰি আৰু যে সব সঁচা হয় সেইটো ডকুমেন্ট
platelets are targeted, and leukopenia if white blood cells or immune cells are targeted. And that last one's kind of a mind bender because it means that your immune system is attacking your immune system. All right, so the last two criteria have to do with specific antibodies being found in the blood. The first one being anti-nuclear antibody, which we already went through. Now, a large proportion of patients with lupus have these, meaning this test is very sensitive. But this test isn't very specific, since these are also seen in other autoimmune diseases. Finally, they can have some other self-directed antibody that is an anti-nuclear antibody, which can be one of three types. It could be anti-Smith, which is an antibody against small ribonucleoproteins, or it could be anti-dsDNA, which is against double-stranded DNA, and is often seen more during periods of active disease. And these two are relatively specific for lupus. A third type of antibody, though, is anti-phospholipid antibody, which is actually usually against proteins that are bound to the phospholipids, and is less specific for lupus, meaning that it can pop up in other situations. There are three types of antiphospholipid antibodies. Anticardiolipin, which can cause a false positive test for syphilis, since anticardiolipin antibodies are also sometimes involved in syphilis. The other two are lupus anticoagulant, also known as lupus antibody, and anti-beta 2 glycoprotein 1. Sometimes, because of these, patients will develop antiphospholipid syndrome, where the antiphospholipid antibodies cause a hypercoagulable state, meaning they're more prone to developing clots and having complications like deep vein thrombosis, hepatic vein thrombosis, and stroke. These patients often end up needing lifelong anticoagulation therapy. So, lupus is characterized by periods of flare-ups and periods of remittance. So, treatment is often aimed at preventing flares or limiting how severe they are when they do happen. To help prevent flares, some patients might have to avoid sunlight exposure with hats or long-sleeve clothes. To reduce severity of flares, corticosteroids might be used to help limit the immune response. And finally, if symptoms are really severe, certain immunosuppressive drugs might be used. Thanks for watching.
Did you all understand?
Yes, ma'am.
All of you? Could all of you understand?
Yes,
Little
ma'am.
bit.
Yeah, they had explained it quite easily. That what ultimately we can understand is that systemic lupus erythematosus is a disease which not only just affects the skin, it affects the entire body. At the end of this thing, no, I mean this video here we can see how every part of the body is getting affected, starting from from the skin. They have said that the skin is affected, wherein in the skin itself you see so many different kinds of rashes, malar rash, discoid rash, then photosensitivity is seen in that patient. Then below the skin, the mucosa, the inner membrane of the skin, even the mucosa is affected. Then ulcers inside the mouth or the nose, then or the outer membrane of those area, then that leads to serositis. Then serositis is what this serositis leads to our organs which are inside, like the lungs and the heart. The outer organs of those areas are affected. See how even like from the skin it's going on towards even towards the innermost organs of the body. Joints, kidneys, means nothing is left out. Every part of the body is affected. Even it goes to the brain and blood. And in blood, it ultimately, the person suffers from problems like anemia, thrombocytopenia, then leukopenia, all these kinds of problems occurs in the body. So this is ultimately, that is why the reason this is because of this, what do you say, the systemic term has been used in the definition of the or in the name of this particular disease, because it is ultimately affecting the entire body, entire organ of the body one by one. Okay, so do you need any more explanation on this, or this explanation was enough to you? Yes, tell me.
Yes, ma'am.
Yes means what, enough, or do you need an explanation on this?
No, ma'am, it's enough.
It's enough. Okay, and did you all understand why this disease occur? What is the Means how it can affect, how it can happen to a person? Could you understand that?
Yes, ma'am.
Two things play
Yes,
its
ma'am.
role. One is the genetic of the person, another is the environment. Okay, both the things when combined, it ultimately leads to this disease. Okay, good that you have understood this. Okay, just a moment, wait. And today I will not take the attendance. I could not show you a proper diagram for that or a proper video. So today I will show you that video for Graves' disease. I hope that helps you to understand it better. I'm just sharing one other video with you. Do you remember Graves' disease, which I had explained yesterday? Hyperthyroidism.
Yes, ma'am.
Yeah. So I'm sharing a video on that.
In hyperthyroidism, hyper refers to having too much, and thyroid refers to thyroid hormone. So hyperthyroidism refers to a condition where there's excess thyroid hormones. The condition is also called thyrotoxicosis and is generally due to an overproduction. Normally, the hypothalamus, which is located at the base of the brain, detects low blood levels of thyroid hormones and releases thyrotropin-releasing hormone into the hypophyseal portal system, which is a network of capillaries linking the hypothalamus to the anterior pituitary. The anterior pituitary then releases thyroid-stimulating hormone, also called thyrotropin, or simply TSH. TSH stimulates the thyroid gland, which is a gland located in the neck that looks like two thumbs hooked together in the shape of a V. The thyroid gland is made up of thousands of follicles, which are small spheres lined with follicular cells. Follicular cells convert thyroglobulin, a protein found in follicles, into two iodine-containing hormones, triiodothyronine, or T3, and thyroxine, or T4. Once released from the thyroid gland, these hormones enter the blood and bind to the circulating plasma proteins. Only a small amount of T3 and T4 will travel unbound in the blood, and these two hormones get picked up by nearly every cell in the body. Once inside the cell, T4 is mostly converted to T3, where it can exert its effect. T3 speeds up the cell's basal metabolic rate. So as an example, the cell might produce more proteins and burn up more energy in the form of sugars and fats. It's as if the cells are in a bit of a frenzy. T3 increases cardiac output, stimulates bone reabsorption, thinning out the bones, and then activates the sympathetic nervous system, the part of the nervous system responsible for our fight or flight response. Thyroid hormone is important, and the occasional increase can be really useful when you need a boost to get through the final rounds of a sporting competition, or when you're trying to stay warm during a snowstorm. Now, hyperthyroidism can happen a few different ways. All of them result in too much thyroid hormone in a hypermetabolic state, where cellular reactions are happening faster than normal. The most common primary cause is Graves' disease, an autoimmune disorder where B cells produce antibodies against several thyroid proteins. These autoantibodies include thyroid-stimulating immunoglobulins, which bind to the TSH receptors on follicular cells and imitate TSH. This results in growth of the thyroid glands and stimulates the follicular cells to produce excess thyroid hormone. Another primary cause is toxic nodular goiter, where one or more follicles starts generating lots of thyroid hormone. In some cases, it's because of a mutated TSH receptor that inappropriately keeps these follicular cells active. A different cause is a hyperfunctioning thyroid adenoma, where the follicular cells start growing uncontrollably, forming a benign tumor that makes excess thyroid hormones. Also, anytime the thyroid gets inflamed or damaged, there can be a large release of preformed thyroid hormones. There's also Jod-Basedow syndrome, or iodine-induced thyrotoxicosis, which can develop soon after an iodine-deficient person gets a hefty dose of iodine. And finally, neonatal hyperthyroidism, which is when newborns who have a mother with Graves' disease start generating too much thyroid hormone in response to thyroid-stimulating immunoglobulin that crosses the placenta barrier and enters the baby. A secondary cause of hyperthyroidism is when there's a healthy thyroid that generates a lot of thyroid hormone in response to a TCH-secreting tumor in the anterior pituitary. The symptoms of hyperthyroidism include weight loss despite an increase in appetite because of the higher basal metabolic rate, heat intolerance because the body is producing more heat, and rapid heart rate, sweating, hyperactivity, anxiety, and insomnia because of the effects of the thyroid hormones on the sympathetic nervous system. Sympathetic overstimulation of muscles that control eye movements also make the eyes appear more open than normal, so you see more of the whites of the eyes. If the hyperthyroidism has been ongoing for a long time, there is a risk of developing congestive heart failure and osteoporosis. A thyroid storm is a life-threatening complication of hyperthyroidism where the body goes into a state of severe hypermetabolism. It can develop when someone with hyperthyroidism stops their treatment, develops an infection, or has surgery. All the normal symptoms of hyperthyroidism become exaggerated. For example, heat intolerance turns into high fever, and rapid heart rate turns into cardiac arrhythmia. Diagnosing hyperthyroidism is done by measuring blood levels of TSH, T3, and T4. If it's due to a primary cause, TSH will be low and unbound thyroid hormones will be high. Once hyperthyroidism is confirmed, a radioactive iodine uptake test and a thyroid scan help determine the specific cause of the disorder. If blood levels of TSH are normal or high, this points to a pituitary tumor, which can be confirmed with an injection of thyrotropin-releasing hormone. Treatment varies based on the exact cause of hyperthyroidism, but generally involves drugs like beta blockers to treat the immediate symptoms and antithyroid drugs to block thyroid hormone production and release. Radioiodine therapy can be used to partially or completely destroy thyroid function, followed by replacement hormone therapy. In a few cases, the thyroid is removed with surgery. Alright, as a quick recap, hyperthyroidism refers to any one of a number of disorders where there is an excess of thyroid hormones. It is mostly caused by an overfunctioning of the thyroid gland, but is sometimes caused instead by a pituitary tumor or inflammation of the thyroid. The result is a hypermetabolic state, which causes symptoms like weight loss, heat intolerance, rapid heart rate, and hyperactivity.
Thanks for watching. If you're interested in a deeper dive on this,
What I had showed you here is about hyperthyroidism. It was not exactly, Graves' disease. What I want to show you all was Graves' disease. Today we don't have much time now. I think it's about to get over. I'll find out another video so that I can more easily explain this particular thing to you all. Okay. So I hope you all have understood the systemic lupus erythematosus, and the same way I'll use another video to explain the Graves' disease in the next class. This, I think, the one which I showed you just now was just about hyperthyroidism. I think you could understand the difference.
Yes, ma'am.
Yeah. So it
Yes,
was
ma'am.
what they had told here was the different ways how hyperthyroidism can occur. Okay, different ways like hyperthyroidism is I had told you that it is increase in the level of thyroid. So increase in level of thyroid does not always happen due to Graves' disease. It may happen to several reasons. So the several reasons which due to which the hyperthyroidism occurs had been mentioned here. Now, how particularly Graves' disease occur, that I will explain to you in our next class. Right. So I'll stop the class now. We'll meet in the next class tomorrow. And CR, please send me the names of the 22 students who are present today. Thank
Okay,
you.
ma'am. Thank you.
Yeah.
Thank you, ma'am.
Thank you, ma'am.
Thank you, ma'am.
Yeah.